Hello everyone, and welcome back to our channel. Today, we're diving into a topic that affects millions of people around the world. Migraines. Let's explore what migraines are, their symptoms, common triggers, and effective relief methods. What are migraines? Migraine is more than just a headache, it's a complex neurological disorder. It often leads to intense, throbbing head pain that comes in episodes. During a migraine attack, you might experience symptoms like nausea, vomiting, and sensitivity to light and sound. These episodes can be truly debilitating. 2. Stages of a migraine attack. Prodrome. First comes the prodrome stage. This can start hours or even days before the actual headache. Symptoms include sensitivity to light, mood changes, cravings, and more. Aura. Next is the aura stage, characterized by neurological symptoms. These can include visual disturbances, tingling, and even temporary vision loss. Attack. The attack stage brings on the intense headache itself. Throbbing pain, often one-sided, can be accompanied by nausea, vomiting, and worsened by physical activity. Postdrome. Finally, the postdrome phase follows the attack. You might feel fatigued, irritable, or even unusually refreshed. Migraine triggers. Numerous factors can act as common triggers for migraines. Hormone fluctuations. Many women observe an association between their menstrual cycle, pregnancy, ovulation, and headaches. Symptoms can also be linked to menopause, hormonal birth control, or hormone replacement therapy. Stress. Elevated stress levels prompt the release of chemicals that may induce changes in blood vessels, potentially leading to migraines. Dietary elements. Certain foods and beverages can serve as triggers. Aged cheese, alcohol, and additives like nitrates, found in pepperoni, hot dogs, and deli meats, and monosodium glutamate, MSG, might be responsible for some individuals. Irregular meal patterns. Skipping meals can contribute to triggering migraines. Caffeine. Excessive or insufficient caffeine consumption compared to your usual intake can trigger headaches. Interestingly, caffeine itself can be used to treat acute migraine attacks. Weather changes. Alterations in weather conditions such as storm fronts, shifts in barometric pressure, strong winds, and changes in altitude can serve as migraine triggers. Sensory overload. Environmental stimuli like loud noises, intense lights, and potent odors have the potential to initiate migraines. Medications. Vasodilators, substances that dilate blood vessels, have the capacity to trigger migraines. Physical exertion. Engaging in physical activities such as exercise and sexual intercourse can also act as triggers. Tobacco. Tobacco use has been linked to migraine exacerbation. Sleep disturbances. Inadequate or excessive sleep can result in headaches. Understanding these potential triggers and making necessary adjustments can aid in managing and preventing migraines. Types of migraines. Migraines manifest in various forms. The most prevalent types are those with aura, known as classic migraines, and those without aura, termed common migraines. Additional variations encompass menstrual migraine. This type is closely tied to the menstrual cycle. It typically occurs around 2 days before menstruation starts and lingers for about 3 days after. While other forms of migraines may occur at different times, menstrual migraines usually lack an aura. Silent migraine. Also recognized as acephalgic migraines, silent migraines are characterized by aura symptoms without the accompanying headache. Auras serve as the main indicators, though nausea and other migraine symptoms might also emerge. These episodes typically last for a brief span, about 20 to 30 minutes. Vestibular migraine. Marked by issues in balance, vertigo, nausea, and vomiting. Vestibular migraines may or may not be accompanied by a headache. This type frequently affects individuals with a history of motion sickness. Abdominal migraine. This type is less understood, causing stomach discomfort, nausea, and vomiting. Often observed in children, abdominal migraines may eventually transition into classic migraine headaches over time. Hemiplegic migraine. Individuals with hemiplegic migraines experience temporary paralysis or weakness on one side of the body. Numbness, dizziness, and vision alterations might also arise. As these symptoms could mimic signs of a stroke, immediate medical attention is crucial. Ocular migraine. Referred to as ophthalmic or retinal migraines, this variant leads to transient or complete loss of vision in one eye. A dull ache behind the eye, which might extend to the rest of the head, accompanies this. If any vision alterations occur, seeking medical help promptly is advised. Migraine with brainstem aura. Preceding the headache, this type presents symptoms like dizziness, confusion, and balance issues. The pain is often localized at the back of the head and may coincide with speech difficulties, ringing ears, and vomiting. It is closely linked to hormone fluctuations and is more common among young adult women. Immediate medical evaluation is recommended for these symptoms. Status migrainosus. This severe variant extends beyond 72 hours, inducing intense pain and nausea. Hospitalization might be necessary due to the severity. In some cases, the onset might be triggered by medication or medication withdrawal. Ophthalmoplegic migraine. Pain encircling the eye, coupled with paralysis of the surrounding muscles, characterizes this type. Given that these symptoms could also stem from nerve pressure or an aneurysm, it is deemed a medical emergency. Additional symptoms comprise a drooping eyelid, double vision, and other vision changes. Migraine frequency. Medical professionals categorize migraine occurrences based on their frequency into 3 levels. Episodic migraine. This describes experiencing migraines intermittently. High-frequency episodic migraine. This level involves encountering migraines between 8 to 14 days per month. Additionally, individuals with high-frequency episodic migraines are at an increased risk of transitioning to chronic migraines. Chronic migraine. This designation is assigned when migraines manifest on more than 15 days each month, with at least 8 of those days encompassing typical migraine characteristics, such as head pain of moderate to intense nature, pain that localizes to one or both sides of the head, pulsating or throbbing pain sensation, exacerbation of pain with movement, presence of nausea or vomiting, heightened sensitivity to light and sound. Statistics reveal that around 12% of the American population encounters migraines periodically. However, only about a third of this group experiences chronic migraines. Chronic and high-frequency episodic migraines can lead to incapacitating conditions. Moreover, the intensity of pain within each migraine episode correlates with its disabling impact. Thus, establishing a collaborative treatment plan with your healthcare provider becomes particularly crucial. Migraine diagnosis process. When seeking a migraine diagnosis, your medical practitioner will engage in a comprehensive evaluation. It can be beneficial to maintain a symptom diary and note any triggers you've identified. Be sure to include the specific symptoms you're experiencing, along with their location and intensity, the frequency of your episodes, the duration of each episode, any family members who also have a history of migraines, a list of all medications and supplements you're taking, including over-the-counter products, details about previous medications you've used. In addition to this, your doctor might conduct tests to exclude other potential causes for your symptoms, such as blood tests, imaging examinations like MRI or CT scans, electroencephalogram, EEG. These evaluations aid in confirming a migraine diagnosis by ruling out alternative underlying conditions. By combining your medical history, symptom patterns, and test results, your doctor can provide an accurate assessment and recommend an appropriate course of action. Migraine management and remedies. While a definitive cure for migraine headaches remains elusive, effective treatment and prevention strategies are available. Common approaches encompass over-the-counter, OTC, pain relief. These medications, encompassing acetaminophen, aspirin, caffeine, and ibuprofen, are often efficacious. However, exercise caution with OTC pain relievers, as excessive usage could exacerbate headaches or lead to dependency. If you're relying on these drugs more than twice a week, consulting your physician about prescription alternatives like triptans, newer ditans, and gepants might be beneficial. Never administer aspirin to individuals below the age of 19 due to the potential for Reye's syndrome. Prescription medications. Celecoxib, Celebrex, Elixib. This prescription NSAID impedes the production of specific pain-inducing hormones. It's used to halt migraine progression. Administered as tablets once or twice daily, Celebrex, or as a daily oral liquid, Elixib. Triptans. These drugs help balance brain chemicals. They can be ingested as pills, orally dissolvable tablets, nasal sprays, or injections. Examples comprise almatriptan, Axert, elatriptan, Relpax, rizatriptan, Maxalt, sumatriptan, Imitrex, and zolmitriptan, Zomig. CGRP receptor antagonists. In cases where other treatments prove ineffective, your doctor may prescribe Rimespant, Nurtec, or Ubrogepant, Ubrelvy. These are administered in tablet form. Lasmiditan, Rayvow. This pill mitigates pain, light or sound sensitivity, and nausea. Home remedies. Resting in a dim, quiet room with closed eyes. Applying a cool compress or ice pack to the forehead. Ensuring adequate hydration by consuming ample liquids. Complementary and alternative treatments. Biofeedback. This approach heightens awareness of stress triggers and can preempt an impending migraine attack, especially if the headache's onset is gradual. Cognitive behavioral therapy, CBT. A specialist imparts insights into how actions and thoughts influence pain perception. Supplements. Certain vitamins, minerals, and herbs such as riboflavin, coenzyme Q10, and melatonin have shown potential in preventing or treating migraines. However, some caution is advised due to possible impacts on liver enzymes, particularly with butterbur. Body work. Physical therapies like chiropractic care, massage, acupressure, acupuncture, and craniosacral therapy may alleviate headache symptoms. Consult your doctor before pursuing these alternatives. Prescribed interventions. Ergotamine, Cafragot, Ergamar, Migragot. This agent acts on brain chemicals. Nausea medication. If nausea accompanies your migraines, your physician can prescribe appropriate medication. Preventive medications. If standard treatments prove ineffective or your migraines are severe, your doctor might recommend regular use of preventive medicines. These can include seizure medications, blood pressure drugs like beta blockers and calcium channel blockers, some antidepressants, and botulinum toxin type A, Botox, injections. CGRP antagonists such as atogepant, Calypta, eptinezumab, Vyepti, irenyumab, Aimovig, fremonezumab, Ajovy, and galcanezumab, Emgality, can also be preventive options. In addition to pharmacological solutions, various devices target brain and nerve stimulation for migraine management. Single-pulse transcranial magnetic stimulation, STMS. This device is placed on the back of the head during an aura phase migraine. It emits magnetic pulses to specific brain regions, potentially halting or alleviating pain. Neuromodulation devices. Other devices interact with the vagus and trigeminal nerves to provide relief or prevention from migraines. Remember, every individual's response to treatments can vary, so working closely with your healthcare provider is key to tailoring an effective plan. Preventing migraines. Here are effective strategies to proactively prevent migraine symptoms. Recognize and avoid triggers. Maintain a detailed diary of your symptoms to discern patterns and pinpoint triggers. Stress management. Employ relaxation techniques like meditation, yoga, and mindful breathing to mitigate stress-induced migraines. Maintain regular eating patterns. Adhering to consistent meal schedules can aid in preventing migraines. Stay hydrated. Ensure adequate fluid intake to avoid dehydration, a potential trigger for migraines. Prioritize rest. Getting sufficient sleep is crucial for migraine prevention. Engage in moderate exercise. Regular moderate physical activity can contribute to preventing migraines. Consult your doctor. If migraines coincide with your menstrual cycle or lifestyle changes aren't effective, consult your physician about potential preventive medications. Additionally, innovative devices can play a role in migraine prevention. Cephally. Resembling a headband, cephally emits electrical pulses through your forehead skin. It interacts with the trigeminal nerve, linked to migraines. Employ cephally daily for 20 minutes, during which you'll experience a tingling or massaging sensation. Gamma core stimulator. This device sends mild electrical signals to the vagus nerve fibers in your neck. It not only relieves pain but also aids in preventing migraines. By implementing these strategies and utilizing advanced devices, you can take proactive steps to minimize the occurrence of debilitating migraines. Impact and coping. Migraines impact millions of lives, causing discomfort and disruption. However, with awareness and effective strategies, you can better manage and prevent their occurrence. Thank you for joining us today. If you found this information valuable, please hit that like button and subscribe for more informative content. Remember, seeking advice from a medical professional is crucial for personalized migraine management. Stay informed, stay healthy. Until next time, take care.